Huntington's disease is a genetically inherited neurodegenerative disease. It affects 5 to 7 people per 100,000 in Western countries. Every person with a HD-positive parent has a 1 in 2 chance of inheriting the disease. Symptoms are categorized into 3 groups: cognitive, physical, and personality and emotion. Chorea is a physical symptom that is characterized by abnormal involuntary movement, usually brief, abrupt, irregular, and unpredictable. It can involve various parts of the body and can interfere with swallowing, talking, posture, and gait. Although there is no cure for Huntington's disease, there is a new drug on the market that helps with the treatment of chorea, known as Deutetrabenazine, with the trade name known as Austedo. It is a vesicular monoamine transport inhibitor. Although the mechanism of action is unknown, it is thought to be linked to its effects as a reversible depletion of the monoamines from the nerve terminals, which results in a decreased uptake of these monoamines into the synaptic vesicles and depletion of monoamine storage. Deutetrabenazine is taken orally once per day in tablet form with food and swallowed whole. Dosage is dependent on reduction of chorea and its tolerability, starting at 6 mg per day. From here, dosage may increase in 6 mg intervals weekly, with a max dose of 48 mg. The drug's peak concentration is reached within 3 to 4 hours after administration, and it has a half-life of 9 to 10 hours. With an extent of absorption of dosage being 80% of the drug, it is predominantly renally excreted. Contraindications include patients who are suicidal, inadequately treated for depression, have hepatic impairment, and should not be taken in combination with monoamine oxidase inhibitors, reserpine or tetrabenazine. Prior treatment of Huntington's-related chorea was the drug of tetrabenazine, an isotopic isomer of deutetrabenazine, in which 6 hydrogen atoms replace the deuterium atoms present in the newer drug. Tetrabenazine has an effective method of treatment for Huntington's-related chorea. However, recent comparative studies have demonstrated the potential superiority of the newer drug. The inclusion of deuterium atoms in Austedo effectively slows the rate of drug metabolism and allows for less frequent dosing. It is to be noted that both drugs have no proven differences in motor scores, efficacy, or safety. One study measured successful reduction of chorea in Huntington's patients and produced an outcome of 19 patients and a mere 6 control placebos with a success rating. Another study clarified that deutetrabenazine also was less likely to produce severely adverse side effects compared to other drugs such as tetrabenazine. Pharmacokinetically, deutetrabenazine also has a higher half-life than such drugs, with superior absorption without exceeding peak plasma concentrations. As a result of this, patient compliance is improved with increased period between doses. The AIMS Abnormal Involuntary Movement Scale is used to measure the manifestation of TD in those receiving antipsychotic treatment. It has been proven with overwhelming evidence that deutetrabenazine is therefore very effective in reducing AIMS scores in clinical studies. Overall, it can be concluded that deutetrabenazine is indeed the safest, most effective, and most relevant drug involved in the treatment of chorea in Huntington's disease. Austedo may cause Parkinsonism in patients with Huntington's disease, as rigidity can develop as part of the underlying disease process in Huntington's disease. It may be difficult to distinguish between this potential drug-induced adverse reaction and progression of the underlying disease process. Drug-induced Parkinsonism has the potential to cause more functional disability than untreated chorea for some patients with Huntington's disease. If a patient develops Parkinsonism during treatment with Austedo, the Austedo dose should be reduced. Some patients may require discontinuation of the therapy. Therefore, chorea treatments such as deutetrabenazine treat the underlying cause. It is a symptomatic approach for the treatment, whether it may be a temporary or chronic case. Chorea affects a person's voluntary and involuntary movement control and increases a person's likelihood for falls. Home care measures should be included, such as installing non-slip surfaces to prevent injury. Recent research shows adverse event rates were similar for deutetrabenazine and placebo, including depression, anxiety, and akathisia. However, the drug does increase the risk of suicidal thoughts and behaviour as well as depression. It also must be taken into consideration that if the current patient has a clinical history of depression, their drug usage must be closely monitored. People with Huntington's disease may have a higher risk of depression and suicidal thoughts or behaviours. Taking deutetrabenazine may further increase this risk. However, the benefits of taking this medicine will result in an improvement in daily living, which in some cases may outweigh the risks of suicidal behaviour. Your doctor should check your progress at regular visits, and your family or other caregivers should also be alerted to changes in moods or symptoms.